Thank you, Presiding Officer. Yesterday, the Finance Secretary laid out the SNP government's budget for the upcoming year. Thanks to a UK Labour government getting rid of the Tories and ending the era of austerity, the Scottish Government have an additional £5.2 billion to spend. This was an opportunity to confront the challenges facing our country and take us in a new direction, an opportunity clearly missed. And nowhere is that more important or clearer than with our NHS. So when 1 in 6 Scots are on an NHS waiting list, why is the height of John Swinney's ambition that by March 2026 Scots won't have to wait more than a year just for an appointment?
First Minister.
The Government, as I've explained to Mr Finlay, is absolutely focused on improving waiting times, and the record financial settlement for the health service of £21 billion is a very significant contribution to enabling that to be the case. And Ministers will work with health boards, as I saw when I visited Forth Valley Royal Hospital on Monday, on initiatives to practically improve waiting times in our hospitals. And Mr Sarwar has my commitment the Government will do that. Now, I'm really interested in Mr Sarwar's language about new direction, because if Mr Sarwar doesn't like the direction we're taking about health service expenditure, do I take it to mean that he doesn't support the increase to £21 billion? Does he want less than that? Is that new direction? Is that the new direction that Mr Sarwar wants, that he wants us to have less investment in the National Health Service? Now,
let's hear the First Minister.
What I'd simply say to Mr Sarwar is this. I welcome the investments that are being made in our public services and our public finances as a consequence of the United Kingdom Government's decisions. That is welcome. I've made that clear before. But what now matters is, will the Labour Party support the Government by making sure that those numbers can be put into practical reality? Will the Labour Party support the Government's budget to make sure we can invest £21 billion in the National Health Service?
Sarwar.
I think John Swinney's forgotten. He's not a bank manager. He's meant to be running a country, delivering positive outcomes for the country. And all he does is what he normally does. This SNP government focuses on the inputs and not on the outcomes for patients across the country. And within the last week, we have had damning reports from the IFS and Audit Scotland. The IFS, despite proportionally higher spending and more staff, Scotland's NHS is lagging behind England. On almost every measure, performance is worse. There are poorer outcomes for Scots. Audit Scotland, despite higher funding and more staff, fewer patients are being seen. No clear plan for reform. No delivery plan. Greater leadership is needed. But yet again, these warnings have been ignored. So why is this SNP government squandering the opportunity of £5.2 billion of additional money and record levels of spending that could actually take our NHS in that new direction?
First Minister.
Presiding Officer, if we look at some of the issues on performance, for example, there has been an increase in the number of operations performed in the National Health Service over the last 12 months. We have seen increases in the performance on waiting times in a number of different disciplines. If we look at cancer care, there has been improvements in the performance in relation to the 31-day standards, so that more patients have been treated and been treated in a quicker timescale. Now, Mr Sarwar asks about the squandering of the opportunity. Well, the only squandering of the opportunity that will go on is if the Government is unable to put the practical proposals in the budget into practice on the 1st of April. That means this Parliament has got to pass the Government's budget. Now, we are open, very open, to constructive discussion with political parties about the contents of the budget. But Mr Sarwar will, in his own words, squander the possibility of strengthening our public services if he doesn't vote for the Government's budget.
Sarwar.
Presiding Officer, can I remind John Swinney that SNP MPs voted against £5.2 billion of additional money coming to the Scottish Government just there. And John Swinney did what he always does, read out a long list of inputs and not actually address the issues that would improve outcomes for patients. The usual sticky plaster approach.
Let us hear Mr Sarwar.
I can understand why his blood pressure is high, don't worry, Presiding Officer. The usually sticky plaster approach, all about inputs and not about outcomes. Because it's not just about how much you spend, it's about the quality of care that patients receive and the health of our nation. It's not just about how much you spend, it's about supporting businesses to thrive and grow. It's not just about how much you spend, it's about our children leaving school with the skills they need. And all measures, John Swinney and the SNP have failed, just hoping they can spend more money in the same way and get a different result. But isn't it clear that this is a government with no plan, no leadership and no vision for Scotland?
First Minister.
I think there's really a big problem if the opposition leader in this Parliament cannot change his script to adjust to the answers that I give. Mr Sarwar, on a very basic exchange, Mr Sarwar says that I only talked about inputs when I talked about the outcomes and the performance of the National Health Service. So really, it's not good enough for Mr Sarwar, if he can't even step up to be a decent leader of an opposition party, to aspire to do anything else.
Let's hear one another.
If Mr Sarwar is concerned about business, he should be concerned about the impact of employers' national insurance contributions. Because he only needs to look at his UK Government data on this. The impact of employers' national insurance contributions are not going to improve the standard of living in people in the United Kingdom over a 5-year period. So that's a rather gloomy outlook that Mr Sarwar has attached himself to. What I would simply say to Mr Sarwar is that I'm interested in making progress for Scotland. It's what I've been about all my political life. And we've delivered big progress. I told Mr Finlay about the progress on early learning and childcare. We've seen economic performance in Scotland improve faster than in the rest of the United Kingdom. I want to build on that, but it will only happen if Mr Sarwar and his colleagues support a government budget that will repair the damage to the winter fuel cuts from the Labour government, raise the two-child limit, all involved in the government's budget. Mr Sarwar should decide to support the government's budget and deliver a good outcome for the people of Scotland.